Healthcare personnel in the Eastern Cape are frustrated at the deteriorating state of facilities in the province. A number of institutions there are on the brink of collapse. Many face challenges relating to crumbling infrastructure, resource shortages, the inadequate support for staff and patients, as well as a lack of water. Newzroom Afrika Sipa Kema joins us now with more details. Sipa, you've been talking to healthcare workers. They say they are at their wits' end over conditions there.
Absolutely, Iman. And I mean, we weren't just focusing on the big hospitals like Dora and Livingston in Gqeberha, but we're looking at the healthcare system as well as the infrastructure within the Nelson Mandela Bay region. Now, right now, we just came from, Pearson TB Hospital, where we received pictures from some of the healthcare workers there, including some of the union members, where they were showing us how bad it is inside that hospital. Now, just to remind you, that is the TB hospital that we last spoke to you from, where it specializes in TB that is resistant to drugs, and the complaints that come from healthcare workers is that they work under horrible conditions. I'm sure you're seeing some of those visuals right now, the images that are coming from, Pearson TB Hospital, where they were telling us about the conditions that they're working under, but also that they become victimized when they speak out. This also includes the shop stewards. Now, that situation is not an isolated one, Iman. Right now we are in Colchester just outside of Gqeberha, but also under the Nelson Mandela Bay Metro and under the Nelson Mandela Bay region as far as the Department of Health. Now, this is the clinic that is servicing the community, the growing community, might I add, of Colchester. Started off as a small community, but it now has grown and it qualifies to receive its own individual services. And what you're seeing currently now is the clinic that they operate from. Now, when we spoke to some of the nurses and healthcare workers from within this particular facility, they were telling us about the horrible conditions. I mean, we did not believe them, Iman, until we came here and saw with our own eyes the situation that they were describing. Now, this is a toilet that is supposed to be used by the public, but it does not work, so it's closed. And what we're seeing here is that they have stored medication, and some of this medication has actually expired. Some of it has just only recently expired in December, while some has expired over the past year. And we also saw some medication dating as far back as 2022, 2020 even, right here. Now, we're going to move then and show you some of the facilities and health facilities. Now, we were informed that although this might look like it does not operate, this is operational. This is where every Wednesday, the nurses and healthcare workers come to work and service this particular community. This is used as an observation, vital science room where they weigh their babies. Yes, they do indeed, Iman, work from this office. Look at the windows, busted. And you can see up top when it rains, such as today, it is wet on the floor. But also looking at the windows, and you telling me this is where babies are actually observed. Their clothes have to be taken off fully, and then they have to be laid on the baby scale there that we're seeing on one of those beds there. You can see there's still medication also here. This medication, however, and I mean, some of the supplies that are here, they have not expired. These are supposed to be working, but they're not fully closed, Iman. I mean, even the gate was left open. Even the gate was left open, including the facility itself was not locked up. Now, we're going to move to another area where some of these nurses and healthcare workers actually operate from, where we see some files actually on the desk. And as we had said, keep in mind that they do work from here. This is one of the other rooms where they work from. The windows are still quite intact, but you look at the bed, and also you look at some of the files that have been left on top of the desk here out in the open, as well as the register book here that we are seeing. out here in the open as well, Iman. And this facility is still working. But we were told by the healthcare worker that we spoke to, we had to hide our identity as, she was worried about losing her job or being a victim or targeted by maybe other healthcare workers and maybe losing her job. And she said a lot about this facility. This is what she had to say to us.
We don't have equipment to work with. We haven't got PP machines. We don't know where to complain to. We are like just eating up all the nonsense that the people give us because they're complaining to us, and then we get the words from the patients. Then the nurses don't like, or the nurses give us a duty to tell the community we won't be coming, or they're only taking 20 people this week. Then we get all of that ugly words and all of that things. We don't have equipment to work with, broken windows, no electricity. We can't make coffee. The nurses come once a week. They come whatever time they want to come. We're there from 8. They come by 10 or past 10. Then there's a doctor. He comes at 11. Like, they come anytime they want to come. And then they only see the patients once a week. And then if a patient falls ill on a Wednesday night, and they need they need to get now the health services, and then they phone ambulances, they won't come immediately. So that's a problem. They only come once a week.
And now, Iman, we will speak to the people who suffer the most because of these conditions. These conditions, yes, they actually affect the healthcare workers, the nurses that are working at these institutions and facilities. However, the last stop and the ones that bear the brunt of this are the patients themselves. And we will be talking to one of those patients at 12 o'clock who also, as a result of a collapsing system, had one of her children pass away, and she will be telling us more about that and also her experience being serviced at this particular clinic in Colchester.
Sipa, and as you've been at pains to remind us, this is a functioning healthcare facility. People go there, it's working, because we could be forgiven for thinking this is an abandoned clinic, this is an abandoned hospital. And yet what you're showing us is a live facility. What are we hearing so far, Sipa? I know that we're at the moment just showing our viewers, and you're doing a walkabout and an expose really to hospitals that are simply not working anymore. But what are some of the officials saying about the state of disrepair? What are the various hospital and clinic superintendents saying?
Well, Iman, we've reached out to the Department of Health, but not specifically at each particular hospital, but the department itself, as that's where the buck stops. But they have not yet responded, but they said they will be responding to our questions regarding the healthcare system, the infrastructure, the working conditions of healthcare workers, therefore affecting the services that they give the patients. We can expect a response from them at least by 12 o'clock to what exactly is going on, because from our understanding, some of the healthcare workers and the nurses that we spoke to say that these matters have consistently been reported to the department. At Jose Pearson TB Clinic, one of the shop stewards that we spoke to, who actually assisted us with those videos, was actually telling us that they got a protection order against them by one of the operations manager of that hospital because they were asking too many questions and trying to get accountability of the services that were rendered at that hospital, but also the dilapidating and deteriorating infrastructure where patients have to go and collect buckets of water just for hygiene purposes and also to ensure that they've got enough drinking water as well. So he says that as much as they've tried to be vocal about it and they've tried to speak and engage the hospital management, he received a protection order against him, and he was then transferred to work and become a shop steward at another clinic. They removed him from Jose Pearson TB Hospital.
unconscionable situation there. Sipa Kema, thank you very much for bringing that to our viewers. And certainly, as we've seen with other stories of this nature, often these types of exposés result in some action being taken, and we hope that it's all for the benefit of those who need those services.